This end, please.
Thank you, and good evening. I'm Dr. Sheri Swokowski, and I did not find an old suit in my closet this morning. I'm a retired Army colonel who recognizes transgender discrimination when I see it, partly because I was fired from a Washington, D.C. government contractor position when I transitioned almost 20 years ago. So if you're looking for a long-term study, I think myself and some of the adults, trans people that gave testimony here can be that study for you if you're really interested. The good news, after I was fired, shortly thereafter, a couple of months, I was hired into the Pentagon as a senior analyst for Headquarters Department of the Army. I noticed there are no MDs or PhDs on the committee. I think I got that right. And I'm glad to hear that you rely on professionals to inform important decisions. I hope you will afford me that same courtesy. I've lived the transgender experience. I've conducted extensive research on the social, legal, and medical transitions for about a quarter of a century. The short title of my doctoral dissertation was Barriers to Care. Kind of rings hollow in here. As a researcher, I find the amount of misinformation that's been presented today astonishing, particularly in the bill's introduction. And I'll address a couple of those issues at the end. In the face of virtually every major medical organization in the world who recognize the value of gender-affirming care, it seems we have unqualified legislatures in Wisconsin and other states that insist on inserting themselves into private medical issues that are best left to the patients, the parents, and professionals. I was here at this desk when Representative Kramer introduced his what turned out to be an unfounded and certainly infamous bathroom bill. Yet here we are 8 years later playing the same games with children's lives hanging in the balance. I have to ask you if towing an ideological line is worth the death of children to you. It's not hyperbole. It's factual. Suicide rates are high when trans kids are not supported. I wonder how your colleagues with kids and grandkids who suffer with chronic diabetes would think about you taking away their insulin, introducing a bill to do that. This is the exact same thing. It's only the medication that is different. In prohibiting medically necessary care, in penalizing those who are sworn to do no harm, you are literally killing kids. Wisconsin, it seems, with this bill, has become a follower and no longer a leader. I want to wrap up by saying that the World Professional Association for Transgender Health has had standards of care in place for more than 50 years. It came in during the 1970s. There are virtually no irreversible surgeries performed on transgender kids, and no surgery performs on kids unless you're talking about cisgender girls who end up getting breast reduction or breast augmentation as they desire. When we started out, there was some talk about how many trans youth detransition or change their mind. The actual data says that 96 to 98% of trans youth continue on in transition as adults. It's pretty clear cut. When we talk about biology, biology is much more than XY chromosomes and the genitalia that you were born with. You can't cherry pick the low-hanging fruit to make a point. It doesn't work that way. There are 26 million cells in a fetus. That's where the transgender issue starts. You would think the odds of having everything go perfectly in 26 million cell divisions, you might think maybe something has gone a little bit wrong. I want to end by saying Senator Strobel had it exactly right. This bill does not solve every problem, but it certainly creates a lot of them. And with that, I'm happy to take any questions you may have.
Questions?